Rabies, the hidden danger from pets that you might not expect. When it comes to rabies, many people often think of it as a distant issue, only occurring with stray dogs or in remote rural areas. But in reality, even close family dogs and cats can become dangerous sources of infection, posing a direct threat to human health and life. Understanding the mechanism of the disease, the symptoms that appear in pets and humans, as well as the importance of vaccination, is essential to protect oneself and the community. In underdeveloped countries like those in Africa and Asia, most rabies cases are due to dog or cat bites. In developed countries such as Europe, the USA, and Canada, most rabies cases are exposed to wildlife such as bats, skunks, and foxes. Rabies is an acute infectious disease caused by the Rhabdoviridae family of lysovirus, primarily spreading through bites, licking, or scratches from infected animals. When the virus enters the body through a wound, it attacks the central nervous system, causing extremely severe effects. What is even more frightening is that rabies almost certainly leads to death if not treated promptly with rabies vaccine and serum. The pathogenic mechanism of rabies begins at the moment the virus is present in the saliva of the infected animal. When a rabid dog or cat bites a person or another animal, the virus enters the body through the skin at the wound site via saliva. Here, the virus does not spread immediately, but hides and multiplies at the bite site for a period of time, known as the incubation period. This time can last from a few days to several months, or even years, depending on the location of the bite, the amount of virus, and the immunity of the bitten person. After the incubation period, the virus begins to travel along the peripheral nerves towards the spinal cord and brain. Once it reaches the central nervous system, the virus rapidly multiplies, causing severe damage to the brain and spinal cord. Subsequently, the virus follows the nerves to the salivary glands and other organs, increasing the likelihood of spreading to other humans or animals through saliva. In pets like dogs and cats, rabies shows very clear symptoms, but can easily be mistaken for other health issues in the early stages. Pets may exhibit unusual behavioral changes. A normally gentle dog may suddenly become aggressive, howl a lot, scratch everywhere. Or conversely, an active dog may become lethargic, fearful, and avoid its owner. For cats, the symptoms are similar, which may include growling, scratching, or avoiding light and different sounds. In the next stage, pets often exhibit symptoms of jaw muscle weakness, continuous drooling, inability to swallow, foam at the mouth, and may show signs of seizures. They will become uncontrollable animals, running to bite anyone or any nearby animals. In some cases, dogs or cat, will show symptoms of general weakness, lying still in one place, unable to eat or drink, and will ultimately die after a few days of illness. For humans, rabies presents very clear symptoms, but these appear only after the virus has attacked the central nervous system. In the early stages, the patient may feel itching, pain, or burning in the area of the bite, even when the wound has healed. Subsequently, neurological symptoms will begin to appear: fever, headache, fatigue, anxiety, and irrational fear. Especially, the patient will have hydrophobia. Just seeing or hearing water can cause throat spasms, difficulty breathing, or even panic. There are also symptoms of fear of drafts, excessive salivation, difficulty swallowing, facial muscle paralysis, and generalized seizures. As the disease progresses, the patient will fall into a state of hallucination, complete paralysis, and death within a few days to a week after the onset of symptoms. The frightening thing is that there is currently no specific treatment method for rabies. Once symptoms of rabies appear, there is almost no chance of survival. Therefore, prevention is the only and most effective way to protect oneself and one's family from this danger. Vaccinating pets against rabies is a responsibility that dog and cat owners cannot take lightly. Vaccines help pets develop immunity to the rabies virus, reducing the risk of infection and transmission to humans. Typically, dogs and cats should receive their first rabies vaccine at 3 months of age, followed by annual boosters. Vaccination not only protects pets, but also safeguards the community from the risk of rabies outbreaks. Not only should you vaccinate your pets, but if you are bitten or scratched by a dog or cat, whether the wound is small or large, you need to take immediate action. The first step is to wash the wound thoroughly against the soap and clean with water for at least 15 minutes. Then, proceed to disinfect with alcohol or iodine antiseptic solution. After that, go to a medical facility for advice on rabies vaccination, and if necessary, receive rabies immune globulin. Rabies immune globulin is very important in cases of bites on the head, face, neck, or deep, multiple bites, as it provides immediate immunity, helping to prevent the virus from entering the nervous system before the vaccine starts to take effect. Many people often overlook that dogs and cats kept indoors, without exposure to the outside, do not need vaccinations. However, the rabies virus can spread through many pathways, even if pets come into contact with wild animals or through intermediaries like mice or bats. Therefore, vaccination has never been unnecessary. Rabies is not only a concern for pet owners, but also a potential danger to the community. Every year, tens of thousands of people die from rabies worldwide, mainly due to not receiving timely vaccinations or neglecting minor wounds. Don't let your ignorance or carelessness make your loved ones victims of this terrifying disease. You should be enthusiastic about vaccinating your pets, handle situations correctly when bitten by dogs or cats, and raise awareness in the community about rabies prevention. Remember that prevention is always better than cure, and your safety starts with small actions today. Thank you, and see you again.